Hi, I'm Carly, pediatric speech pathologist. Today, I want to talk a little bit about breastfeeding your baby with a cleft. In most cases, there are a couple of exceptions, which I'll talk through, but in most cases, babies with a cleft generally can't fully breastfeed because the cleft means that they can't create that suction within the mouth, in the oral cavity, to be able to draw milk out of the nipple effectively. And we can't really do a lot to be able to get around that so that they are able to breastfeed exclusively. However, that doesn't mean that you can't provide your baby with breast milk or do some comfort breastfeed. So I want to just talk around some options today. What I will start with though is the cases where full breastfeeding might be possible with a baby with a cleft. So if your baby has a cleft lip only, then with some positioning and some sort of support to create that lip seal. So things like using the breast tissue to fully close the cleft. So sort of helping to push the breast tissue into the cleft to help create that seal, or using some support just with your finger, just very gently. You don't want to do it hard or be rough about it at all because that can make baby disengage from feeding, but just using your finger to push the lip across to try and get the lips to meet in the middle as much as possible to help try and create that lip seal as well, then some babies will be able to feed effectively enough from the breast so they can fully breastfeed. The other exception is if your baby has a cleft palate, but it's a cleft of the soft palate only, and it's quite a small cleft. Sometimes in that case, they're still able to get enough suction in the mouth to be able to extract milk. In all other cases, generally full breastfeeding isn't possible. So you will need to feed your baby using a specialized cleft bottle. But that doesn't mean, as I said, that you can't still have some breastfeeding or feed your baby with breast milk. So a really good option is to express breast milk and give it via a cleft bottle. That's not the right option for everybody. Expressing is a big commitment. It takes a lot of work to maintain your supply, and you do need to express really regularly for that to be effective, but that definitely is an option. And if that's something that you would like to do, I will get support from a lactation consultant around maintaining your supply through and support with the expressing process as well. The other option is to provide some comfort breastfeeds. So not for nutrition, not to be getting milk from the breast, but just some comfort breastfeeding, sort of similar to sucking on a dummy or a pacifier. It's a really nice bonding experience for you and baby, and you still get that, I guess, experience of breastfeeding if that's something that you've wanted to do. Baby sometimes will get a little bit frustrated if they're not getting much milk out though, so it's not always successful. But again, it can be a really good option if you're not able to fully breastfeed. And then you would then give their feed via the bottle still, via a cleft bottle. The other option with some comfort breastfeeding, and again, I'd suggest to get some support from a lactation consultant with this, but you can use like a nursing, like supplemental feeding system that is just a really thin little tube that's attached to a bottle that has some milk in and sits on the breast so the baby is sort of sucking on that and milk drips into the baby's mouth as they're sucking on the breast. So that can help if they're getting a little bit frustrated because they're not getting milk. So they'll get a little bit. Generally, it's still not enough to support their nutrition and hydration. So you wouldn't necessarily achieve full feeding using that, but that can also be another option. With everything with feeding, some having support in place is really, really important to help you through some of the challenges that go along with feeding a baby with a cleft. So speaking to your cleft team, your cleft nurse, speech pathologist, or a lactation consultant to support breastfeeding as well is really important. So as always, I hope this was helpful. Like and subscribe or follow me on Instagram for more tips and tricks around feeding your baby with a cleft.